Now, you identify the correct pair. So, you should remember the first one, the mummification is this one. Then adipocere formation is what you see here. And marbling is what you are seeing here. And the lividity, post-mortem lividity is what you are able to see over here. So, all post-mortem changes in one stop is what you need to basically remember. Now, last AIMS also, AIMS November 2017 also, we came across the question of alternative names of the substances which are abused. It's a favorite area in the examiner's question bank. Though question paper mein aaye to once more in some other form, the question will come in the forthcoming exam, November 2018 also. So be very sure. So doctor, heroin is called brown sugar. Eve is the name which is being given for the amphetamine. Joint is the name for the ganja. And LSD is called the purple haze, is the name with which, at least if you don't get seat in MD, learn how to order for a good narcotic drug with a proper name. You know, the guy who is selling you should not say, "Kya hai yaar tujhe MD mein bhi seat nahi hai," or properly you don't know how to order the cocaine also, right? On light vein. So, first hand knowledge rule is applicable in which situation? So, it is a common witness. A person who gives evidence about the facts observed or perceived by him is called the first hand knowledge rule of the common witness, not a specialist, but a common witness is what you have to basically remember. An employee has more employers and the new master is not responsible for his actions. What is this rule basically called as? For example, if you are a junior resident, you are working under the surgery professor, working under the medicine professor, you are also working under the anesthesia professor. Now the question is, with whom you are working most recently is the one who will be the one who takes the liability whenever any error occur because of you. Not all your old masters. What is that called as? It is called the borrowed servant doctrine is what need to be remembered. So what is meant by vicarious liability? Why is your HOD in the morning rounds is in temper tantrums to look at your case sheet as a house surgeon or a junior resident? What is the reason? Have you guessed? By mistake, if anything error happen by you, is caused by you as a house surgeon or a junior resident, error of commission or error of omission, it is your HOD who has to go and sit in the court of law to explain. So the liability doesn't fall on you, liability fall on your boss. That is the reason the great advantage is housemanship, junior residency, happiest time. When you become consultant, you are responsible not only for your errors, but also for the errors of your people who are working under you. So that is called vicarious liability. All acts done by the servant in and about his master's business are done by the master's express or implied authority. That's the reason master is responsible, you are not responsible, is the whole idea. An employee may serve more than one employer, but the surgeon, the pharmacist may be working for a surgeon, an anesthetist, etc. If any error happened because of the anesthetist, the surgeon is not responsible, which is called the borrowed servant. Contributory negligence. Two patient को overdose लिखा, same time Patient भी अपना दवा लेना बंद कर दिया. You have written a wrong dosage and patient also stopped taking the medicine. Finally, patient died. Then you can claim that he did not take the drug. That's the reason he died. And the patient can claim that no, the doctor did not explain me properly when to take, how many times to take. So both of you contributed for the development of the negligence. It's called contributory negligence. So what is the importance of contributory negligence? Contributory negligence, failure to follow the doctor's instruction. And just contributory negligence is not an absolute defense. Suppose if you say that I did not diagnose this case because patient symptoms history properly he did not give me. If you say that is the reason that please excuse me for a wrong diagnosis bole to no court will listen to you. It's a partial immunity for you, but it is not a complete immunity for you. You might have used a more tactful questioning of the patient and might have taken a better history. That's what judge will tell to you. Contributory negligence is applicable to conscious patient, whereas in unconscious patient, it is the guardian, his mistake is the one which is being taken as a contributory part of the contributory negligence is what need to be remembered. So the jury will sit and say, the plaintiff was careless too, that's the reason the doctor is not always the one who is culprit. So that is called contributory negligence. Which is the test used for the fetal maturity is a very important question. Did you click on record? Yeah. Fetal maturity test is a very important question. I am very happy to see 193 online students Kush Hua Mogambo. So we should quickly go to those days where we have about 700-800 online students and we enjoy a glorious evening every day, right? So amniotic fluid creatinine is one of the important indicators of the fetal maturity. But if you say fetal lung maturity, it is the L/S ratio, foam stability test, lamellar body count, bilirubin scan, alpha-fetoprotein levels. They are all the important markers in case of fetal lung maturity. Then what is meant by nitrazine test? The pH of the vaginal secretions normally is between 4.5 to 5.5. Whereas the pH of the amniotic fluid is 7 to 7.5. So suppose if you are suspecting premature rupture of membranes, how will you be able to judge it? Typically you use the nitrazine paper which is impregnated with the dye, and the color reaction will enable you to know whether it is a vaginal fluid or the amniotic fluid, and the nitrazine will turn from yellow to blue only at a pH more than 6. That means only if the amniotic fluid got leaked out, which typically happens in premature rupture of membranes, is what you need to remember. And for that you will be using the nitrazine test. Then what is Furning pattern is a very important question. Typically the amniotic fluid crystallizes like a fern-like pattern because of the sodium chloride proteins and carbohydrates, which will also help you to recognize the presence of the amniotic fluid leaking in case of the rupture of membranes. Similarly, the Nile blue test also will enable you to know that there is amniotic fluid leakage. In this, the Nile blue sulfate will lead to development of the coloration of the amniotic cells is what you need to remember. So this is the fetal epithelial cells can be discovered in the amniotic fluid if you use the Nile blue sulfate, which will lead to the development of the staining is what you need to ultimately remember. Now what is meant by, one of the option was given Breslau's test, Reddens test. What is the meaning of them? Breslau's test means, basically these tests are used to know whether the baby is born already dead or he was born live and then has died after birth. So to differentiate the two. The stomach and the intestines from a dead body baby, if you happen to put it into a bucket of water, then it will sink. Whereas if he is already live born, he has breathed and air went into the gut. So that is the reason if you happen to stomach and intestines, if you tie the two ends and then put it into water, then it will be floating if it is a live born. Similarly, Reddens test means what? If you remove the roof of the middle ear, then there will be bubbles of the air which will come out. If at all the baby was born alive is what you need to ultimately remember.